Thank you, everyone, for joining our podcast. This is the HelloNote ClinicTalk podcast. So I'm excited today to introduce Ann Reilley from Reilley Physical Therapy out in Ithaca, New York. Hi, Ann. How are you?
I'm great. Thanks for having me today.
Awesome. Definitely looking forward to having you on and asking a few questions about your business journey. So we know that you're in Ithaca, New York. Is that where you grew up, or did you make a move there? What does that look like on your end?
So I grew up about an hour and a half away from Ithaca, New York, in the
Mhm.
Finger Lakes region of upstate New York. And I then lived in Syracuse, New York for a little while. I did my doctorate in physical therapy at Upstate Medical University in Syracuse and worked as an exercise physiologist in the Syracuse, New York area. And about 10 years ago, moved to Ithaca.
All right, awesome. And did you have a practice outside of Ithaca?
Yeah, no, Reilley Physical Therapy is the first business that I've owned. I did not own a practice prior. When I first moved to Ithaca, I worked for a Cayuga Medical Center and visiting nurse services, a hospital in the community, and a home care agency in the community. And then I started the practice in 2020.
Awesome. So 2020, so right around the pandemic. Oh, wow, that must have been tough, but how did you decide to open up your practice during that time?
I would say that, we all can think about the pandemic and that first year of COVID and what things
Mhm.
happened to us, or what things shaped or changed, how we responded to the pandemic. The one thing that positive for me that I came out of 2020 with is my own PT practice. So I actually started the practice in response to what was going on with the pandemic, and just in response to how I was able or not able to serve the people in the community. I worked in an outpatient office, that kind of nudged me to start thinking about a different way of delivering care and service.
Absolutely. Okay. So you found some positivity during that time and you brought that to patients, which of course was needed during that time. And now, 4 years later, how has your business grown over these 4 years? Did you start it by yourself and now you have a team, or do you have a partner?
Yeah, so I started by myself, and I thought that I had kind of expected that it would take maybe 4 years before I would even hire anybody. And here I
Yeah.
am with a pretty big team. So I started by myself, running the business, doing everything from the scheduling and the intake, marketing, referrals, the counting,
Mhm.
billing, seeing patients. And so I was doing a little bit of everything. And within about 6 months, I was working many, many hours doing that. I was during the typical workday hours, seeing patients, and then doing all of the other stuff whenever I had time. And so I hired two therapists within about 6 months. They
Mhm.
were
Nice.
both brought on full time because I was having a hard
Wow.
time keeping up with referrals. I was seeing patients sometimes six, even more, sometimes 7 days a week. So I brought on a few therapists, and I continued doing all of the practice management and all of the administrative stuff for a while. And about 3 months later, I brought on some administrative staff. And since then, it's gradually grown. So there's now 7 therapists in the practice total. And I have a part-time
Are they all
administrative.
full time?
They are. Yep.
Wow.
So they're all
Very nice.
full-time. So full-time for the practice is about 25 visits a week, patient visits a week in the home.
Mhm.
And I have a part-time administrative assistant, and I have a full-time practice manager in addition to the
Cool.
clinicians. So that's kind of been a gradual build of the team. And here we are 4 years later.
Wow. Awesome. Awesome. I love that. So you definitely did all that heavy lifting yourself in the beginning and you grew your team, you grew your business. So that's awesome. That's not easy to do. A lot of people, when they get stressed out, especially if they don't have any prior business experience. Did you have any prior business experience at all, or you just started with the practice?
I never owned a business, but I've always had roles in terms of like program coordinating, event planning, managing something going on, whether it be like a project management type thing.
Yep.
So even when I worked full time for had hospital-based jobs, I was always on some sort of like project or research project, and I was usually involved in some level of managing that. And I've always kind of enjoyed that type of thing. And I've held different leadership positions, even as a student. I was, the president of student government and things like that. So I think I've always been drawn to think about owning a business similar to like being a leader in the community. Even when it was just me, I was leading the way in terms of like who I'm working for. At that time, I was
Right.
working for patients and the providers. So yeah, I kind of have a little bit of that background and interest, but I've never owned a business before.
Okay. Well, that is inspiring because I think a lot of therapists out there, they do love that leadership role. And as you said, they could have been a leader in their community, doing certain projects. But the fact that you were able to open up a business, a practice with no actual business experience and be where you are today, that's awesome. So congratulations on that. And the fact that you already hired so many full-time therapists. I've worked with a lot of, so with HelloNote, we do work with a lot of clinics and there's a lot of part-time therapists and there's nothing wrong with that. But it seems like in your case, every single one of your therapists is full-time because you're able to get those referrals and get your staff. So on the topic of referrals, what works for you? You said you have a lot of referrals coming in. So what works for you? Is that are these coming from a specific group of doctors? Are you doing marketing?
Yeah, it's a good question. So it's a little bit of mix of both. And I always think of the word like scaling marketing and just trying to scale my business. And so marketing, I've been really kind of strategic, trying to be strategic in terms of making sure that we can keep up with what we're asking for, essentially.
Yeah.
So we don't do heavy marketing for referrals. What we market in the community is the brand of what we do, what our mission is, the mindset of providing that one-on-one care in the home, the caring. We are spending that time with our patients because we care about the patients, and kind of word of mouth type of thing. The marketing that I do is keeping up with a website that's managed by a marketing team. And I keep up with some printed materials for office, like the physician offices. We don't have a strong social media presence. And
Is that by
that's partially
choice or?
yeah, so me personally, I never have. And so I could use that. I felt like I need to, but part of why we don't, every time we re-look at our marketing plan and I talk about social media, I'm not sure that unless it was something that I was really interested in or somebody else in the practice was interested in, that it would give us more in terms of marketing benefit than what we are already doing. So we're in the community. For example, this week, it was Fall Prevention Awareness Week, National Fall Prevention Awareness Week, and we were in the community doing a couple events, and that's huge. That's a key way of getting your name out there, and not just mine, the other therapists, getting people to know that it's not Ann Reilley, it's Reilley Physical Therapy. We're a team, we work together, and
Awesome.
meeting people in the community, serving the community. That's really kind of how I built the practice, essentially, as I had already been in the community doing things before I went and started the business side of it, and volunteering at different events that are pertinent to what I'm doing. Try to have a strong community presence, and physicians over time, even prior to when I started the practice, had really gotten great feedback from patients. And so there's a set of physicians in the area that when they found out that I started my own practice, were very excited, first of all, that I was going to be going to people's homes, but that they could continue to refer patients, even though I was now outside of the network that I was working for prior.
Cool. So it sounds like you already had kind of an identity in the community. And when you launched your practice, and I love that you mentioned, it's not just you as your name, it's Reilley Physical Therapy and you work as a team. So did those referrals like grow as more time grew with your team, or did you have kind of like the problem of you have therapists to staff, but you don't have enough referrals, or is it the opposite where you have a ton of referrals and you need to go and staff them?
Yeah, so it's changed a little bit over time. So I'll talk about in the beginning. In the beginning, it was a matter of I started my initial marketing was because I did have an identity and a presence in the community in terms of my specialty being geriatrics, and there's just not a lot of therapists in this area that do that. So that made it a little
So
bit.
You said there's not a lot of therapists?
There's not.
Really?
There's not.
Wow.
So that did help me out in terms of marketing. So starting out, I had that kind of reputation for being, a specialist in the area, and that helped out. So from there, the referrals started coming in, and I was able to, again, keep up on my own. Few therapists that were brought on the team, I had patients ready, like referrals were there, and I needed to either say no to people or bring staff on, and to serve a greater number of people, I needed a bigger team. Right. Then there have been times, the way that I've really focused on building the team is this is how I word it. If someone reaches out and submits a resume or asks if we have an opening, I'm not really filling positions. I don't have an office where I have a desk. I don't have an office space where I need to make sure I have a certain number of people. Yep. I'm growing a team of therapists that work well together, that share the mission and the vision of the practice. and that want to provide the type of care that I want to be providing to the community. And not every therapist lines up with that. And that doesn't mean that it's a quality thing. It might just be a different area of interest that they might have or whatnot. So as the team has grown, we're bringing on therapists that have, might have an interest in working in a certain area of the county, and I might try to push a little bit of a little bit of marketing in the area and try to drive some more referrals in that area. I'd say for the most part, we're hiring because we need staff to take the referrals. Yeah. But there have been some times we've hired because the person I did not want to lose the opportunity to work with that person, that therapist, and then we will grow the caseload in that area if we need to develop in that area.
Yeah, no, that's a smart business decision as well, because sometimes, you find a great therapist, they great skills with a patient, and then you work on growing the caseload. So it sounds like you're on both fronts as well. So you had experience on both sides. So that's awesome. And it also sounds like you're genuine, your company's genuine, as you know who you serve, and you don't just hire anybody. So that's really important. And I think that's why you also have so many referrals, because patients are probably telling the doctors their good feedback, and you get more referrals. And also, it's not about the doctors too. Do you also get a lot of word of mouth referrals? Others recommend others, and they hear about you, more kind of organic marketing as opposed to something that you're doing on the back end?
I would say that marketing directly to physicians is a tough space to be in when you're in private practice, because a lot of physicians have some connection with maybe a bigger network, or they're based out of, they have hospital rights, and most of those hospitals have outpatient clinics. So if you have a few key practices that are directly recommending you and referring you, you can build that reputation. That's great. But sometimes it's better starting with some patients that have had a great experience and had a great outcome working with you. And they go mention it to the physician, or they tell their neighbor, and their neighbor will specifically say, I would like to have the referral. Oh, can you send that referral to Reilley Physical Therapy instead of wherever they might have otherwise referred to? And so I think that we probably half our referrals are people, maybe the physician suggesting that referring me, maybe it was suggested elsewhere, but the person's requesting, or they've been a patient of ours in the past, or they've been a participant of some of our wellness programs, and now something's come up where they need physical therapy services, and they want to utilize our services because we already know them.
Awesome. Okay, very cool. So let's take it back a little bit. So I know you're mobile based. You're in-home Part B physical therapy, correct? So with that model, do you feel like in your area, is that why you're getting a lot of referrals? There's not many other companies doing that? Or there are plenty of kind of brick and mortar clinics out there, and they're choosing you because of your reputation? Or is it because there's not a lot of competition in your area?
I think it's a mix of all of that. So I think that, at this point, 4 years in, I think a lot of it's reputation and the branding of the practice, and the reputation
that goes
of
a long way.
It does. And I have a therapist who's been working in the practice. Brian Burns is now the clinical team lead. So he does a lot of working on clinical excellence within the team. He's been with me for 3 years. So he was one of the first therapists I hired. And now he's got this reputation. And then, each of the therapists, as they've been within the practice for 6 months to a year or longer, it's like the team's reputation. It's quality, but it's quality because we care. It's quality because we communicate with the providers. If something's not going the direction we want, we refer, we communicate, we refer back, and and physicians and referring providers like that. So I think that's a piece of it. There's this branded reputation now, and that's a part of marketing, is branding what you, and everyone you hire on your team has to present the way you want that to look. And I think that we've done a nice job, and I say we, because it's everybody together working together to create that presence. So that's a piece of it that takes time to build. And so I think that the other reason is there is not another practice this big in this area doing this. So there's home health agencies, but as far as outpatient care, we are the go-to. There's not a lot of other options. So that helps me a lot in terms of competition. And I think it also is a little bit of people kind of find out about, even people that aren't homebound or would have, there are a lot of brick and mortar for how small the county is, there's a lot of offices. So our services are not for everybody. We have had people call and really want to work with us because they've heard about us from somebody else. Say, my home's not really set up the best for it, or I have two really crazy dogs. I don't really want anybody to come to the house. Do you have an office? And some people are like, oh man, I can come to you if you have a place. And those people, we have good networks with the other clinics, and we have, if it's for this is to go to. Good. If it's, we don't specialize in hand therapy, for example, but I know a private practice who does. And so we kind of refer. So I think it's a mix of just, those people that want you to come to the home and they want it to be somebody from our team. And also there's just not a lot of competition in this area.
Awesome. There's a lot of great points on that. Number one is, when you started 4 years ago, there was not a lot of competition. And even now, it sounds like you're still the biggest in the area. And it's also great the fact that you work with the brick and mortar clinics. Like, you don't treat them as competition. So you can send patients to them. They send you patients depending on the patient need, which I think also builds on your brand and identity, that you don't kind of just gather patients for yourself just because you want the business, right? Because today it might be a good fit for brick and mortar, but next year it might be a good fit for in-home, and that clinic might refer to you. So that is awesome. As far as brick and mortar, is that something you thought about doing, or did you initially say you're just going to do mobile and you don't want to do anything with hybrid? What does that look like your end?
Yeah, I often think about opening a brick and mortar, and I've looked at spaces, and I then often stop thinking about it, because it'll be something where I've had a conversation. I'm pretty good friends with a local real estate agent, and I have a conversation about it and what spaces are. I'm keeping an eye, and then I'll go to my next patient visit and I'll walk in the home, and it just happens that person says, I can't tell you how much I love that you come to the house. I had this, and this, or I was waiting for somebody to come fix my hot water tank today. And if I had this appointment at the office, I would have had to cancel, and wait in the waiting room. And so people always are giving me all these reasons. And it's not because a lot of our patients aren't homebound.
Right.
We work with older adults that are
one of the
golfing
awesome
and playing
things
tennis.
about this type of model is that you don't have to treat homebound like the certified home health agencies and all of that. So,
so there's all these different reasons, and it seems very ironic, but almost every time I really started to seriously think about, am I ready to maybe have, it would be hybrid if I ever did open an office space. I really look at it closer and realize that in order to do that, it's changing my business a lot. So the team right now, we are very busy going to people's homes. So now, how am I going to staff that place? Is this going to be something where I'm now 2 days a week not out in the home and I'm in the office? Is it something where, who's going to be there? And I feel confident that we could grow the patient caseload and do well. And I've thought about using a space for some of my wellness services that are currently on Zoom. But I do feel like most of the time that we consider it, and I really look closer, we are the only group doing this. And so I'll go back to that idea of referring elsewhere. Same thing for my Zoom exercise classes. If that doesn't work for somebody, there are so many gyms. There are so many other options for people that don't want us to come to their home or don't want to exercise over Zoom. That there are no other people doing what we're doing. And so I just keep going and hanging on to that. And it's one of those things that I still really am very passionate about doing it the way we're doing it. And I think adding a hybrid to the mix would just complicate things. And it would take away from how well we can do it the way we're doing it.
Right. Because you're going to spread yourself too thin. So right now, but listen, you're 4 years in, it's still young. So that's really good. There's a lot of time to still grow the business and do other plans. So you did also mention wellness, right? So one of my next questions was going to be, what is your kind of split with insurance, cash-based? So it sounds like you do take insurance, of course, and cash is an option as well.
Yeah, as far as the percentage, I will be honest, I would have to double check right now where we're at. Because we're just newer to HelloNote. So in this transition of systems, I would have to double check. But I think we're probably I'd say 40 cash and 60% insurance based.
Okay. All right.
Maybe a little bit more like 30-70. But it also varies and fluctuates throughout the year. So that's visits, the actual like going to the home, doing those visits. So we offer self-pay exercise or essentially like fitness coaching sessions. We also do fitness assessments. We promote most older adults should be having some sort of like fitness assessment every year. We put kids through fitness assessments when they're in school. And then as we get into adulthood, we just stop keeping track of how fit we are. So we do those, and those are not, something that people are doing every week. So we have quite a few services that are health and wellness and fitness based that are not necessarily on an ongoing basis in terms of every week we're seeing that person. So that's a piece of it. But then we do some other things. We have a certified health coach on the team. So we do some health coaching. And sometimes patients who are physical therapy patients might benefit from health coaching in terms of just, looking through barriers and goals and things like that. And then I teach exercise classes. I teach 7 classes a week on Zoom.
Wow.
And I have a pretty big group of people that do them. So sometimes I have up towards 45 or 50 people on my screen exercising from their home.
And you do that?
I teach that. I teach that here, actually.
Awesome.
Right here. Yep.
That's awesome. Are you in a space where, is it like part of where you live, or is it a rented space?
Yeah. So I have an in-home office space that I do office work, and then I also teach my classes. And
very cool. Cool. So as far as your team goes, so you mentioned you had some fitness coaches. So I know you right now you specifically do physical therapy. Any plans to bring on like occupational therapy in the future, or speech therapy, like other practitioners that can go into the homes?
So that's a good question. And so the answer is I would have to change my business a little bit, actually quite a bit.
I'm not asking because I'm an occupational therapist. I'm just curious.
No, so the answer, no, it's a great question. So there are, in certain states, you cannot hire anybody who is not, so in New York State, I cannot hire an OT or a speech therapist unless they're a partner in the business.
Right. I know that it's a crazy rule,
So
you have to give
but
a
I understand
small percentage if you want them in, right?
So I do understand it, though. It protects each of us as like licensed providers, like, in terms of it protects each profession. So if I would pull people in. If we were to ever become a little bit more comprehensive of a outpatient rehab, it would be pulling in partners of those disciplines. Yes. And I could see that happening. Again, it's similar to how I've grown the physical therapy team. It has to be the right people, and it has to be the right people that really want to work with this similar population, and really their mission and vision aligns well with what we have going. And we do collaborate quite a bit with other disciplines. There are some occupational therapists in the area who has a similar practice model, but they do half pediatrics, half geriatrics, and it's a little mixed of, it's not as clear-cut focused on the population we're working with, but we do collaborate and have mutual patients. And then there's some other offices that have outpatient services in the office for those disciplines. So we do a lot of work with some of the local speech and therapists and OTs. I don't see that happening anytime soon, but it could.
Okay.
And I know, like in New Jersey, and I don't remember what other states. There's some states where you don't. That rule doesn't exist, so you can start an outpatient.
Most states, yeah. So one of the things I focused on a lot earlier, also around COVID. So I work closely with Kara Welke. She's an occupational therapist, and she has a program that helps therapists build their business. Work together. When we started this, we knew so many therapists coming in from different states, and we quickly learned New York and California are one of the hardest states to open a business, which doesn't mean you cannot, but they are hard because, especially in New York, because you have to form either a PC. So right now, is your company a PC because you're a single discipline?
Yeah, it's a PLLC.
PLLC. Okay. Yep. Yeah. So when you have multiple disciplines, you have to have a PLLC. When you're a single discipline, you actually can be a PC. In your case, it's actually good you're a PLLC because you can eventually go in and bring on another discipline. But there is a rule here, so you would have to have a partner in the business. So, and I know that's concerning because, you're inviting somebody else onto your business. So you have to make sure the business plan and the person is the right fit. right? Because once you bring on partners, there's a ton of other things that you have to think about. So I appreciate the honest answer. So it hasn't happened yet, but it's something you're open to. So that's awesome. All right. And are your therapists W-2 or contractors?
That's another topic of conversation that
Yes.
you could get. Yeah, they're W-2. So
Okay.
there's rules to follow with that too, and not to
Yep.
get into all of that. But yeah, I feel like the way that we're building the team and everyone, I mean, I'm supporting the continued ed, the training, and and they're W-2. I'm
Okay.
not.
Awesome.
They're not contractors. They're working as W-2. I do have one contract employee actually that I just was thinking about this. She's a fitness instructor. She
Mhm.
has done some recorded and some substitute like Zoom exercise class teaching for me.
Yep.
But that's different.
All right. That's fair. And do you also employ PTAs or everyone's a physical therapist?
I do not employ PTAs, partially just the whole concept of being in the home. And I know for a little while during the pandemic, the
It was
supervisory
extended.
rules
Yeah.
were a little bit lifted and a little bit more lax,
Yep.
but I couldn't guarantee how long that's going to be for. And I couldn't think about
Right.
bringing somebody on that I didn't know that
And
I
then
could
having
keep
to let
on
them
and then
go.
have to, right. So,
Yeah. No.
no, physical therapy, just the physical therapist. And the idea too is, so if we do the eval, then we meet the person, we're with the person and not
Yep.
passing the patient and that kind of stuff. I think
Right.
it works much better in an office to do that. In the home, it's a little bit, like I say, clunky to have like, oh, now this therapist is going. So we've
Yeah.
had to have that happen at times if somebody's out for a reason. But for the most part, we meet the person and that's our patient.
Okay. Very cool. So as far as the business, I know you said you do a lot on the back end for the business as well. What are some like reports, analytics that you run on a weekly, monthly basis that help you know where your business is and know what your caseload is? And I know you're fairly new to HelloNote as well. So if there's something you don't know, we'd love to make sure that you know there's a report for that. And we're also listening to feedback. So if there's something that you think, oh, this report would be great, we're always open to it. So what do you use currently or previously that helps you run your business?
We look at a mix of productivity in terms of each therapist, in terms of visits per week, as I
Okay.
kind of keep track of that, like how many patients they're seeing in a week. But also within that, like we look at units per visit. And I look at things sometimes units per week, visits per week, and then units per visit. Sometimes, the way things get reimbursed, sometimes visits per week, you could be at a lower number of visits and bringing in more depending on how
Yeah.
much how it was billed or how it was reimbursed.
Right.
So I'm looking at all of that in terms of productivity. We look at cancellation rate. I know that's something that a lot of people really try to keep an eye on. That's something that isn't with the population we work at. Yeah, we have cancellations as long as it's not fluctuating a lot and there's not key periods of time in the year where it's out of hand and we have to really intervene to do something about it. I'm just keeping an eye on it. I'm looking at reports in terms of the self-pay services. We're looking at Medicare cutting and insurance not being as reliable, trying
Yep.
to increase our percentage and get more closer to the 50-50. And so incentivizing that, I've been trying to, incentivize that to the therapists as well. Without taking away from being able to offer the services we offer to people that are in need of the services and it's medically necessary and we're going to use their insurance, but
Mhm.
trying to build that a little bit. So I'm running reports that help me keep track of that and where we're at with that. I also do look at physician referrals. So how many referrals from physicians, how much is coming in from each of those referrals and that kind of stuff too. So those are some of the key things that we're looking at.
Awesome. And what about like compliance, things like as far as knowing like how many notes are in draft? Like if our therapists completing their notes on time, is that something that you have to kind of enforce or
Oh yeah.
they're
Yeah. So the things that my team kind of knows that I'm not a micromanager, but there's two things that I micromanage. If notes aren't done in 48 hours, they'll hear about it. And it's
Okay.
we run missed notes reports. We look at it and make
Yeah.
sure that they're done. And everyone's different. Some people, I know every practice is different in terms of how often they're billing and how often they're looking at that, but we run them regularly. And then the other thing that we, in terms of compliance is I guess it's not compliance, but in my being mobile, one of the things you have to keep an eye on is you can quickly be inefficient when you're driving around. So if I see on the schedule that somebody is somehow driving past someplace and then going back because it was not, so I'm looking at that, and there's not a great way to run reports on that, but I do still work with the administrative staff on making sure we're really, I call it the art of scheduling. You don't have to think about that when you're in an office because people come to you and you're there, but there is that too. And so sometimes I catch inefficiencies on the schedule by looking at productivity reports and like, well, what's happening? Like, and then I look at it, I'm like, well, that's why we gave this person, the poor therapist and sometimes we do it to them and they just, don't say anything. So those are the things I look at in terms of, but I definitely am looking at missed notes and then plan of care sign for insurance. We are definitely keeping an eye on making sure we're getting those plan of cares back and that they are in our system so that we have them. Awesome. So those are the two.
Cool. No, very good. As far as the inefficiencies with scheduling, I don't know if you noticed, we now have a feature called Show Map. So it actually pulls up a map on all the patients that are scheduled, and you can isolate the provider so they can use that to kind of build the route for them. So
I just happened to see that when I was browsing through just a couple days ago, and I haven't explored it, but I got very excited when I saw anything related to a map just because of what we're doing. Yeah.
Awesome. Yeah. And we'll be building on it as well, but it's a brand new feature. So just wanted to make sure you saw that. Awesome. And then just quickly, as far as insurances, like plan of care report, you mentioned you're monitoring the units and all of that. Do you bill Medicare Part B? Do you deal with HMOs and PPOs? Because those sometimes have, authorizations and visit limits and things like that.
So we are open to taking any insurance for the most part.
Right?
Well, right. So what we like is we do offer to verify benefits for a patient. And so having the EBV, which we are just getting a handle on utilizing that with HelloNote is key. And then if we need, we will call. I used to think it's the patient's responsibility. I'm not, why would I, when it was me doing all the, like, I don't have time. Like sometimes I'd be pulled over waiting on hold forever when I got a patient and I would stop doing it. But what happens is in the long run is, then you might turn down somebody that you might actually get reimbursed quite a bit from their insurance, or you take a chance and then you don't get paid. And then it's to me, time up front to do it and be completely honest with the patient, whether or not they have in or out of, we're out of network with all of them, but some people have in-network coverage. Some people have in-network, but a higher copayment. Some people have they don't have any out of network, out of network with a higher copayment. Some people don't have out of network coverage, but decide, you know what, they'll call back and say, I've called around. I've actually decided I still want to work with you. So there's times that being open to taking that and verifying it and being very upfront, like this is how much it's going to cost, it's turned into some self-pay cases. Yeah. And for those patients that are not on Medicare, we can charge them self-pay if they elect to see us out of network.
With a super bill or receipt. Yep. Okay, awesome. Well, Anne, thank you very much for your expertise and sharing your business journey. So is there any advice you want to give to others that are looking to open up a practice of their own?
I think, if you're considering opening a practice, the first thing to do is have for yourself a clear idea and mission, vision, and focus on what you're going to be most interested in doing, because that's what's driven me over the last 4 years. I still love seeing patients. And I love what I do, and that the team knows that, the community knows that. And I think going into something that you love, that you are going to be excited about, that's going to help you brand it. That's going to help you gain that identity and that space in the area that you're working in and serving. Think about narrowing it down to something that's specific, but something that you can really be passionate about, and then it can always grow from there. But I think sometimes people try to get into something that sounds like a good idea because, I didn't do it just because nobody else wants to do geriatrics. It just happens that I moved to an area and I was doing geriatrics somewhere else, and now it's just grown for me here. So
awesome. Well, thank you for the advice. And again, thank you for your time, Anne. And definitely looking forward to seeing you grow and scale even more. So definitely appreciate it. And we'll talk to you soon. Thanks a lot.
All right, thanks.